Hypertension, also known as high blood pressure, is the leading cause of death and disability globally, the leading cause of risk of death and disability. Now that's according to the World Health Organization, and doctors say this condition is even more prevalent in young adults, especially now than earlier. Here's Mama Biuso Abwaje with the head of cardiology at University of Ghana and Kolebu Hospitals, Dr. Joseph Akama, on how we can prevent high blood pressure.
Hypertension is more prevalent among young people these days, and that's very scary for me as a young person, and that's why I got out of the studio to this place. This is Kolebu Teaching Hospital. We've come to the cardiothoracic department. We are in the echo room. Or is it the echo room? Well, Dr. Joseph Ankama will tell us a bit more about it, especially where we are. He's the head of cardiology at the University of Ghana Medical Center and also the Kolebu Teaching Hospital. And he's gracious enough to take us through a few things. Good morning to you, Doc. Thank you for allowing us here.
Good morning.
Yeah. So when I heard that hypertension, because hypertension is noted usually, I mean, it's an adult kind of thing for a lot more elderly people who are older. Why are we young people these days getting it too?
Yes. Thank you very much for having me and coming to our place. So as she said, this is Kolebu Teaching Hospital. This is the Department of Medicine, Cardiology Department, Division of Cardiology. And I'm the head of cardiology. Now, at cardiology, we have two cardiology services. Those provided by the Cardiothoracic Center, by the National Cardiothoracic Service. That is a separate entity, which is really an enclosure within Kolebu. But when it comes to Kolebu proper, this is where cardiology is. So we have two, you can say there are two cardiology services in Kolebu, literally.
Okay.
So at the Department of Kolebu, we see a lot of Department of Medicine at Kolebu, we see a lot of young people with hypertension. And unfortunately, they come in with bad effects of hypertension. And when I say bad effects, is when they come in, they're either having a stroke or they're having heart failure. And this is very disheartening. And there are so many reasons why this is happening.
Okay, let's go back just a little bit. You're talking about young people between what age?
Between 30 and 45. 30 and 45. The average age of stroke, that is a hypertensive complication, is around 50s. And that is very alarming. That means that our working population, as soon as they get trained and they are really settled in a job, they come down with hypertension complications. And that is not the only problem. They also come in with other complications like renal failure. Okay, so in Ghana, hypertension is about the #1 reason why people get renal failure and they end up on dialysis.
Doc, you have to explain first of all what hypertension is.
Yes.
And then we'll come to renal failure.
Good. So I'm so emotional about this that I took you straight to how the young people present. So hypertension is a condition where the pressure within the arteries are more than what physiologically, what we want it to be. What does it mean? Everybody needs a blood pressure of a sort to operate. Your blood has to move from the heart to your end organs, meaning the brain, the kidneys, the liver, using the pressure. So it's like when the water department pumps water from Wager, there must be a pressure in there to reach Accra, to reach East Legon, or wherever they get their water from. If there's no pressure, the water will not get there. Similarly, when your heart pumps the blood, it needs a pressure to get to where it's supposed to go for operations. So the heart beats about 70 times a minute. That is very fast, since inception till now. And so that pressure is what we measure. If it is above 130, we start getting worried. Definitely in Ghana, if it is above 140, you are categorized as being hypertensive. Normally, when we measure, and this is the machine we use to measure, I'm going to be checking your blood pressure, if you don't mind.
No, that's fine.
On that machine, this is an Omron. I'm not selling Omron, but it is one of the standard machines that we use in Ghana, and Kolebu has graciously provided this for all the clinics. They're using electronic methods now. On the machine, it gives you systolic pressure, diastolic pressure, and then it gives you the heart rate, the pulse rate. So what I'm saying is that if the systolic pressure is more than 140, then you are consistently, then you are hypertensive.
Okay.
If the diastolic pressure, the bottom one, is more than 90, then you are hypertensive. What does it mean? When I say consistently, sometimes you get to the clinic, you are nervous, they check your blood pressure, it's a little bit high. The doctor say, calm down, come and check it again. But if all the time they check it, anytime you go, they check it, and it's consistently about 140 over 90, then you're hypertensive.
Is this like a constant figure for every person? Because
yes.
Sometimes your BP levels, yeah, exactly. Yes. I know
So
I have a peculiar case.
When I say yes and no, what I mean is, if your blood pressure is low, consistently it should be low.
Okay.
If your blood pressure is high, consistently it will be high unless they treat you. But outside that, if you're normal, there's a range in which you operate.
Okay.
Sometimes, for instance, we'll be checking your blood pressure and we'll tell you, you can go up to assuming we'll get it to be 100. You can go all the way to 120 certain times and come down to 90.
Can we do it now?
Yes,
okay.
Let's check your blood pressure.
All right.
So, normally we have you relax. You've been here for a while.
Yes.
We will.
So I hope that I'm relaxed.
I'm thinking you are relaxed.
Okay.
You look relaxed. So we'll put a cap. It doesn't matter which arm, but preferentially, depending on how you sit, we'll put it on. And there's a marker which should be on the inner portion of the arm. And we'll make sure that the cuff is well circumscribed, well tight, not very, very tight around the arm. And then we'll put this ideally at the level of your heart. So if you're on a table,
so lying down.
If you're lying down, we'll put it at the level of heart. Sitting, we'll put it at the level of heart.
Okay.
This is not conducive, but we're going to use this to measure because of the interview. And then I'll tell you to relax, just don't talk. We'll press on start. And I'm still, and it's at the level of your heart. Now the number is going up, and that's the pressure within the cuff. The computer within this machine tells when it passes your BP. Then it will start the measurement. You see that it does not take long, and we have a number of 127 over 87. Now, this is the first reading. We can measure again. 3 readings usually. Then we can average them.
Okay.
And your number is normal, but it's at the upper limit of normal.
Okay.
Okay? And it's an interview session. You're a little bit nervous, even though you said you were fine. So,
of course I am. I was thinking what's going to be the outcome.
So that may have affected your blood pressure.
Okay.
But this number is okay. But for you as a female, I would say it's a little bit up. And we know the circumstance.
Yeah.
So we're going to check it again and again. And I don't know, our interview will check your blood pressure again.
Okay.
Okay?
All right, sure.
All right. So what does it mean? If this is her true blood pressure, given all the circumstances, her systolic is 127, the diastolic is 85, and her heart rate, that's the pulse rate, is 82. 82 is perfect. Anything below 100, above 60 is excellent. Her blood pressure, as I said, even though it's normal for a woman at her age, is a little bit high. And we're going to be talking about that. And I said, for her to be hypertensive, this number should be 140 and above. This diastolic number should be 90 and above. Clearly, she doesn't fall in that range. But I'm hinting her that this number I don't like as a cardiologist, and we'll talk about that. Okay?
Sure. All right.
I'm going to leave this cuff on, and well, we can take it off, so we can check your blood pressure.
Okay. So what is it that we're doing differently, or we're not doing right? That's why we're getting hypertension.
That is causing the hypertension. So there are a number of factors. Number one is the diet, our salty diet. We're having a lot of Ghanaian food has a lot of salt in it. That's number one. Number two is our stress level. Many of us, especially the youth, we're doing a lot of things at one time. What do I mean by that? We have a job, we may need to have a family, we may need to have other sideline jobs. I know most Ghanaians do not just one job, and that is putting stress on us. Apart from that, we also have to have other extra job activities, church activities, schooling. Most people want to further their education. So by the end of the week, you have done so many things that you should have postponed, or at least left for another time. So we're being stressed. What is stress? Stress is normal response to a situation. It is abnormal when it's persistent and causing a problem. Because we all need stress to operate. Okay? So for instance, if a lion jumps into this room, the stress level will go up. We'll visualize it. We'll say we'll secrete adrenaline, our heart will start pounding, our blood pressure will go up, we'll get ready to run. That's a stress level, but we'll mitigate it. As soon as the lion goes away, the stress comes down, it's removed, and we control it. So that's a normal stress. But a situation where the stress is persistent and it's elevated, meaning you're doing a lot of things, you cannot sleep, the hour of sleep is so low. That is a lot of Ghanaians doing that, especially the youth. Number three is our nature. Being a black man or a black woman, being a Ghanaian, puts us at a high risk of hypertension. So if you combine being a black man or a woman and a lot of stress from work, from family, from schooling, and church activities or mosque activities, then you add lack of sleep, then you add a lot of poor dietary practices, fast food, then you're just increasing your risk. On occasion, people have an inherited component. It's not directly linked, but if my mother has high blood pressure, I'm at the risk of getting blood pressure.
Okay.
If my father has high blood pressure, I'm at the risk of high blood pressure.
Okay.
There are few number of patients or people we can pinpoint one cause. By and large, 95% of Ghanaians who have high blood pressure, we do not know the cause in terms of, we can say, let me just take that cause off and you'll be fine. 5%, we can pinpoint the cause, and when we take care of that cause, the blood pressure is normal.
Okay.
For instance, if they have a kidney trouble, blood supply to the kidney is not good, we open that artery, the blood pressure goes down. If they have a tumor that is secreting chemicals, hormones, that make the blood pressure go up. When the surgeons take the tumor out, the blood pressure goes away. By and large, most of us, because it's a mixed bag, your diet, your stress, your family, being a black person, we cannot take one thing off and your blood pressure will go.
Okay.
So we need a multidisciplinary approach.
Okay. You handed me this timetable, and I thought that instead of consume it alone, we would share it with everybody else.
Yes.
So real quick, can you go through it for us?
Yes, so this, I just came back from the American College of Cardiology meeting in New Orleans last week. And this is the new guideline. And what it's telling us is that they are more aggressive. If your blood pressure is below 120, you are ideal. If your blood pressure is between 120 and 139, you are in trouble. You have to start some approaches to controlling it. But they're not going to start you on medications, and that's what we're implementing here. So this table tells you what are the non-pharmacological interventions that a Ghanaian can do to control his blood pressure. Non-pharmacological, you know, Ghanaians don't like medicine. Okay? We don't like taking medications. But if you tell him exercise, weight control, reduce intake of dietary sodium, then maybe he will start doing something about it. So let's take weight loss. If you lose 1 kilogram, okay, you have the benefit of reducing your blood pressure by 5 millimeters mercury.
Okay.
If you have normal blood pressure and you lose that weight, 1 kilogram, you can lose blood pressure. You can prevent the onset of blood pressure.
Okay.
So it's good for both people who have hypertension and those who don't have hypertension. How about healthy diet? Now talk about banku and a lot of palm oil and salty. That's not healthy. But if you look at healthy diet, if you consume a diet rich in fruits, vegetables, whole grains, and low-fat dairy products, that will reduce your saturated total fat, okay? Then you have the chance of reducing your blood pressure by 11 millimeters mercury. That is staggering. If you can do that, how many of us like eating vegetables or fruits, okay? Third one, if you reduce your sodium intake, remember I talked about salt as one of the reasons why we have high blood pressure. If you reduce sodium intake to about 1.5 grams, what does it mean? Maybe 1 teaspoon, or do not add excessive salt. When they serve you and you can taste the food, just take it like that. Don't add more salt, okay? If you're consistent, you'll be able to reduce your blood pressure by 5 to 6 millimeters mercury.
Okay.
Then the last one here, there are others on the back, but that will be exercises and stuff, but we'll continue here. Potassium. So we found out that a lot of blacks, the blood pressure is multifactorial. One of the factors would be our diet is low in potassium. So if you have high potassium diet, like banana, like coconut water, drinking coconut water, and other fruits and stuff, you'll be able to improve your blood pressure. So now let's take, you exercise, you keep a healthy diet, you reduce your salt intake, and you increase your potassium, a whopping more than 20 millimeters mercury reduction in your blood pressure alone without taking medicine. So then when you come to me, I don't struggle. I just give you one medication and then the blood pressure is controlled. So, and it's difficult to do this, but if you can't do it, it gives a lot of benefit.
Well,
and then the back is the exercise.
Okay. We will leave this for a part 2 for the conversation.
Yes.
Because I love it. It's a healthy Thursday, and we want to make this more like a lifestyle. So we want to come again and get a part 2 of this, where I would get the opportunity, because then I'll be better prepared, and then we can do a thorough check as well, so we can share with everybody else. Yeah. How often do you have to do this check?
Well, it depends whether you have any condition or like medical condition like diabetes, family history or not. But what I advise that Ghanaians, because of our risk, you should check your blood pressure every 3 months at least. Why that frequency? Because the guidelines outside say, oh, every 2 to 6 years for young people. But we're seeing a lot of young people who transition between stressful jobs, stressful situations. So every 3 months, if you can check your blood pressure, I'll love it.
Okay.
That is if you're normal.
Okay.
If you're not normal and you have high blood pressure, at least weekly.
Okay. Dr. Joseph Ankama, can we do my blood pressure again?
Yes.
Just the last time.
Are you sure you're relaxed?
I hope so.
Okay, so let's check your blood pressure.
So this is the last thing that we're doing, and then we'll wrap it up. But I promise you we'll do this again next Thursday. So
over here, as I'm preparing to get her BP, we see 2 machines which are used by cardiologists. This is an echocardiogram machine that talks about how to check the person's heart. This is an ECG. So when they get you with a high blood pressure, usually your family doctor will say, I need an ECG. ECG is not electricity corporation of Ghana, but it is electrocardiogram.
Okay.
And it tells about the current that comes from your heart. Blood pressure makes your heart enlarging, and it can tell us immediately.
Okay.
The echo gives us a view of the heart.
Okay.
And it tells us how the heart is functioning.
Okay.
The combination of the ECG echo will risk stratify you.
Okay.
Okay, with your blood pressure.
Okay.
So let's get your. Better. You see?
There's
Better.
a difference?
121 over 84.
What does that mean?
We reduce it from 127. So it's coming down.
Sounds nervous.
You're nervous, you're more relaxed, you're getting. So maybe if we're to stay here longer, have you lie down, it will come back down to maybe 110, thereabout.
Okay.
So this is still good. Consistently, her blood pressure is fine. And look at the heart rate. The first heart rate was 82, and it's 84. So her heart rate is remaining the same.
Okay.
Okay, so this is perfect blood pressure.
Yeah.
So when your blood pressure is more than 140 over 90, what should you do? Start the things we talked about, the diet. See the doctor. Don't fight it. Do not fight the blood pressure. Take it. See the doctor, start some non-pharmacological actions, and then they'll monitor. No doctor will just give you medication because he wants to give you medication. It must be well indicated. And if consistently blood pressure is staying high, then he may advise you to go on medication.
Okay.
On occasion, some people come in, the blood pressure is 200 over 130. Those people are at a higher risk of getting stroke. And then we advise her, look, it's better to go home on a medication and then start the exercise. Take a vacation. Ghanaians, we don't go on vacation. We go for funerals. We don't go on vacation. Take a break out of all the Joy TV and stuff and rest. Take some exercise program, okay? The last one is young men, young women do not take aspirin unless a heart doctor or a well-trained doctor tells you you need the aspirin.
Okay.
Because too much aspirin in your system with a very high blood pressure can cause problems, bleeding into the brain.
All right. Doc, thank you very much. If you're available, we'd like to visit again next week.
You're always welcome.
Yeah. Thank you. And he's head of the cardiology department here at Kolibo and also at the University of Ghana Medical School. Dr. Joseph Ankama, doing justice to this subject of hypertension, high blood pressure, and the fact that younger persons like ourselves, people between the ages of 30, 40, are now getting hypertension. And the sad thing is that they report it quite late.
Yeah.
Yes.
Yeah.
It's like every lifestyle disease. You're not likely to feel symptoms, or you're not likely to recognize any symptoms that you might feel as, that condition. So many people report it at a time when it's too late to do something permanent about it, and then it becomes your lifestyle for the rest of your life. You have to live with it, control it, manage it. But you see, just like diabetes, which we often talk about, when you have hypertension, it's not a death sentence.
Yeah.
It just means you are aware of an aspect of your life that means you must change your lifestyle to control it.
Exactly.
There's no reason why you shouldn't be able to live a long, healthy, productive life, even if you have it. So check. No matter what, don't be afraid of what the results will be. Go to the hospital. It takes how many minutes to do a blood pressure test?
No, less than 5 minutes.
Exactly. And it doesn't hurt, does it?
No, it doesn't.
But I think the doctor was making Mama be a bit
a bit uncomfortable. But I think that it's always good that we get this sort of education, because then we can also onwardly try to transmit this sort of information, because now technology has brought everybody close. We're on various platforms which have massive number of people on one platform, for which we can always do conscientization.
There's a part two of this. What you guys didn't see, what everybody else didn't see, is that I did the ECG, not electricity company of that. I had him check my heart as well. So they've got like state-of-the-art equipment there. I saw the 4 walls of my heart for the first time. This is the first time I've done anything like this. And he explains very detailed. So I'd encourage all of you to go and check your hearts.
Yeah,
it's something that you have to do. You must do. You've checked it before?
Yes, I had a problem, so I got it checked.
Yeah.
But stress in our environment is a contributory factor to many of the things we're feeling these days.
The kind of schedules we run, the foods we eat.
Yeah.
So eat a lot more
the lack
vegetables.
of exercises.
Next week we have a part 2 of this conversation,
that will be
where
great.
we also talk about exercises as well.
That would be great.
Can broken heart also cause high blood pressure?
I'll ask you.
Why have you been broken-hearted?
Yes. Have you not?
No.
Can somebody
not
break your heart?
Oh, Mama.
You're so wicked, and we're wondering.
No, I'm not saying that. That's
okay. Okay, you are so wicked. I'm wondering. She's not saying it.
I don't I can't imagine. I'm just trying to imagine. It's not possible.
You're so wicked.
Why? Why is it
you're
not
so
possible
wicked. I'm wondering.
No.
Yeah, because you are so impassive to people's feelings to many of the time. Yeah.
No, those are not my words.
Those are my words.
This one propaganda. I won't mind it.
I'll take it for you that you're saying.
I'm a very sensitive soul.
Yeah.
I've had my heart broken before.
Okay.
Wow.
Yes.
But that was a long time ago, huh?
This musings from afar.
No, it took me a while to recover.
Okay.
Took you a while.
So so next week I'm going to ask Dr. Joseph Ankama if you can get high blood pressure
from a broken
heart.
Yeah.
Wow. That should be my first question. Then we'll talk about blood pressure in pregnancies as well.
Yeah.
So other things that we'll explore next week, God willing. And then we'll bring him to the studio, because I told him you have to be here.
Yeah.
We activate the phone lines. Those who have followed our conversations can interact with you.
Exactly.
So watch out for that. Exactly. But we have to talk about something else, right? We're still in the month of March. It's still our Ghana month.
Yeah,
definitely.
And speaking of Ghana, it's the president's birthday today.
We have yes,
it's his birthday. He's 75 years old today.
75.
Yes.
So strong.
Happy birthday, Mr. President. Happy birthday.
Yeah.
And may you get all you wish for, and may what you wish for be what we wish for.
But he's gotten what he's president.
Yes, and so may it be what we wish for.
Okay.
And if there's a party at the Jubilee House, may we not be.
Where the party at, Mr. Prez?